Today I want to talk about hepatic hydrothorax or pleural effusion. This is where ascites fluid from your abdominal cavity leaks up through your diaphragm into your pleura space, which is the space your lungs occupy in your chest. When this happens, it's typically on your right lung. For cirrhosis patients, your lung pretty much collapses and you have trouble breathing and you need to get it drained with a thoracentesis procedure. This is me getting a thoracentesis from my favorite doctor. They insert a catheter guided by a very long, very thick needle between your back ribs into the pleura space. They numb it first, of course, but the numbing is the most painful part as a lidocaine burns, and they gotta use a spinal needle, as pictured here, to get that lidocaine all the way in. They inch by inch get it in. My doctors were very good, and they buffered the lidocaine with bicarbonate so it didn't sting as much, but boy oh boy, this was not pleasurable. It hurt like hell a lot. Once it started draining, you could feel some relief and your lungs would re-expand, which is a funky feeling. They kind of itch a lot and you start coughing and it feels weird. But after the procedure, you walk in, you can hardly breathe, you're out of breath. Afterwards, you feel relief, but you're in pain from the procedure. By the time the pain starts fading away, you're filling up again and you can't breathe. It's a vicious cycle. So these are all fluid bags. These are all of mine. I had many of these. You can see my fluid is kind of milky. That's from Kyle, which is like a fat. And it will accumulate in the ascites. Also, if infections look like this, but I was always tested for infection. I never had infections. So those bags are about 2 liters. These are 1 liter bottles. They'll usually only do 2 liters maximum, but this doctor felt safe doing 2.5 for me. I always had a lot. I had this every Monday and every Friday. I had to have these procedures. I'm a bigger person, so I have a larger cavity. Here's another one, almost 3 liters here. That was a big day. Again, another one. You can see another one. Again, I had these a lot. Here's another one next to my back. Here's another one, kind of a pinkish tinge. That's from bilirubin. There's another one that's a little more clear. I was on a ultra low fat diet to see if that would help. It didn't. It was a nightmare. It just made my life even more miserable. But you can see it's not as cloudy. There's another one. And here is